Good day, everyone. I am Princess Sheila Jane D. De Lajero, a student nurse from BSN 111D, Group 14. Today, I will be demonstrating how to don and remove sterile gloves. But first, let us define what is gloves. Gloves is a protective barrier made up of latex or synthetic materials that is used to prevent possible transmission of diseases between healthcare professionals and patients during examination and procedures. Its purpose is to create a barrier between your hands and microorganisms. Specifically, sterile gloves are used to prevent contamination and help control infection. By following the procedures on how to don sterile gloves, we are able to prevent the spread of infections as well as prevent the risk of cross-contamination. The equipment we'll be needing is a pack of sterile gloves. So prior to the conduct of the procedure, I have performed thorough hand washing. We must remember that the use of sterile gloves does not replace hand washing, and so we must perform hand hygiene before and after every procedure. Proper hand hygiene keeps our hand clean and prevent the spread of microorganisms. After making sure that our hands is now clean and safe, we can now proceed to open gloving. I now have prepared my sterile gloves. Ensure that it is the right hand size. It is important to ensure that the gloves fit well for comfort and avoid contamination. If the gloves are too big, it will be harder to hold objects and it will be easier for germs to get inside the gloves. If it is too small, then the gloves will most likely get ripped or decrease the blood flow of your fingertips. That may result to pain and constraints in finger and hand movements. We must check the pack of sterile gloves, making sure that the package is dry and unopened, as well as the date is still valid. Check for tears and stains. This step is important since moisture can contaminate the sterile product, and an expired date would mean that the gloves are not sterile anymore. Next, we must place the sterile gloves package into a clean, dry surface or above our waist. As mentioned, moisture can contaminate the sterile gloves, and any sterile object below the waist is considered contaminated. We will now open the outer package of the sterile gloves by peeling it carefully and remove the inner package by holding the outside of it to avoid the inside from spilling and to maintain the sterility of the gloves. Remember that any moisture on the surface could contaminate the gloves, so make sure not to contaminate it. Now we will open the inner package according to the manufacturer's directions. Open it carefully, not contaminating the surfaces of gloves so that the inner surface will remain sterile. Open it slowly. Now we must identify the left and right glove. For easier application, we must glove the dominant hand first. So since I am right-handed, I'll be donning my right hand first. So now we're gonna be picking up the glove a little using the non-dominant hand by touching only the inside of the cuff. So do not touch the outside of the glove. Note that the hands are not sterile, and by touching only the inside of the glove, we can avoid contaminating the outside. So we pull the glove completely over dominant hand. Slowly. Leave the cuff in place once this unsterile hand releases the glove. So attempting to further unfold the cuff is likely to contaminate the glove. Now we put the second glove on the non-dominant hand. So we pick up the other glove with our sterile gloved hand and inserting the glove fingers under the cuff and holding the glove thumb close to the glove palm. So we're just gonna insert this. So we pull on the second glove carefully. Do not allow fingers and thumb of the glove dominant hand to touch any part of exposed non-dominant hand. Protect your gloved hands to maintain sterility. Touch sterile to sterile only to prevent contamination. Since I have both my gloves on, now I can adjust each glove to so that it fits comfortably. So be careful. Once gloves are fixed, we interlock glove hands and keep at least 6 inches away from clothing. Keep hands above waist level and below the shoulders. This step prevents the accidental touching of non-sterile objects or the front of the gown. Now we have our gloves on. Now to remove and dispose gloves. We grasp the outside of the cuff or palm of glove and gently pull the gloves off, turning it inside out and placing it into the other hand that has gloves. Doing this prevents the contamination of the hand when removing glove. Now take the ungloved hand and slide fingers inside the remaining glove and pull glove off by turning it inside out overhand. This step prevents the contamination of gloved hand touching the ungloved hand. Now discard used gloves using the inside wrapper in appropriate container. Incorrect or inappropriate disposal can result in microorganisms spreading due to cross-contamination. Then we perform hand hygiene to remove powder from the gloves, which can irritate the skin. It also prevents contamination from potential pinholes in the gloves. And that is how you don and remove sterile gloves.